Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius Podcast. This is the Health, Medicine, and Bioscience edition. I have Dr. Mark Abramson. He's a TMJ dentist and a sleep apnea dentist. He does these treatments in San Francisco, San Jose, all the way down to the Monterey Peninsula. He's also, again, he serves Northern California with these things. We're going to be talking about not CPAPs, but oral appliances, these devices that help advance people's jaws when they snore or have apnea, help give them some relief when they sleep. And Dr. Abramson has designed at least one or more devices that are unique and have some additional features. So glad to talk to him. Mark, thanks for coming. How you doing?
Good, thank you. Good to talk to you again.
Yeah.
So let me start with kind of an overview of how important sleep is. We're finding out more every day. There's literally research articles coming out continuously showing how critical not just the time that you sleep, which we're getting as a society much more limited sleep because of staying on television overnight and the computers and the lights that we have on all the time. I know I had a place out in the country that I was kind of off the grid, and when it got dark, I'd go to sleep, or maybe put a little fire on and go to sleep very early, and then wake up, when the sun came up, and be sensitive to the day and night cycles. In my home, are you in my home?
How did you, when you were in that cabin environment, how did you feel sleep-wise and, your mental state versus, being at home in, either suburbs or city?
Well, you feel better. I mean, that's our natural cycle that we really should be living under, but we've gone away from that because of, first of all, lights, television, computers. The main thing, we don't, have enough respect for sleep. But as the research shows, people are starting to appreciate how much sleep is critical. One of the recent discoveries is that, there's stages of sleep. So if you're just getting superficial sleep or you're getting interrupted sleep, you're not going into the deep levels of sleep that it takes time to get into, and you need a certain percentage of your sleep during the night to be in these deep stages. And one of the critical stages of deep sleep is our brain cleans out. Our cells literally shrink up, spinal fluid comes in and cleans out the toxins in our brain. And what they're finding is if you don't have good quality sleep, plus not a good hours of sleep that you're actually dedicating to sleep, you get higher levels of dementia. And so this is really waking a lot of people up, because that's a big fear that we all have is developing dementia someday. But the other impacts are heart disease, stroke, heart attack. So sleep is critical to good health. The human airway is unique, and because of what we're doing right now, speaking, and in order to be able to speak, we had to loosen up and open up our throat. And because of that, we're liable to get blockages of our throat when we go unconscious into sleep. And when we get blocked, we are literally choking, and at some point we arouse ourselves to wake up and start breathing again, but we've interrupted our sleep cycle and limited our deep sleep that we can get. Now, the treatment for this traditionally has been CPAP, which pumps high pressure through your nose and to basically create a air splint in the back of your throat to keep it from being blocked. It works great because you can turn up the pressure to any volume you need, but the irritation from that starts to interrupt sleep, and the annoyance of having to wear CPAP is very problematic for people, and 50% of people fail at least. and give up on it. But more than that, another 50% don't want to try it to begin with. So you might say that 20 to 25% of people actually get treated with CPAP. Now, the medical community has been kind of married to this, and their training says CPAP, CPAP, CPAP. Well, dentists started providing oral appliances that pull the jaw forward and keep the throat open at night. And what's happened over time is oral appliances are becoming much more accepted and utilized by patients. The acceptance with the patient and the continual use is much higher than CPAP. And research has shown that for mild to moderate sleep apnea, that oral appliances are equally effective when you take in all the factors. Severe. Go on.
Quick question here about, you said CPAP's at least 50% just can't tolerate it, and a lot of them don't even want to get it in the first place. I understand why. With oral appliance, what's the compliance rate, and what are some of the roadblocks to people successfully using an oral appliance?
Well, the acceptance of it is very high, and maybe in the 90s. It's
wow.
Yeah, it's very high. And people use it longer hours. What happens with CPAP is in a night, acceptable level of using CPAP is considered 4 hours, but oral appliances are usually used from 7 to 8 hours during the night. So you get a longer time of treatment and ability to go into deep sleep. So, when they do crossover studies where they, like for 2 months, you're going to use CPAP and then you're going to switch over and use oral appliances for 2 months. At the end of the study, people want to continue using the oral appliance rather than the CPAP.
With the, I didn't know that. So people will use the CPAP even if they do use it, usually for about half the night?
Yeah, the bar for saying acceptable treatment is actually fairly low. It's 4 hours a night for 4 nights a week, which is, not really adequate. So, but, I don't care how you do it. I think people need to sleep, and I'm not anti-CPAP. I'm just want people to have availability of all treatments and find the best that works for them.
But physiologically, if that's happening, does that mean that people are preferentially getting deep sleep but not getting REM sleep if they're on CPAP? Or are they getting like abbreviated versions of both? Like what would happen to their sleep architecture over time because of this?
Well, everybody's different, and a sleep study, a full night's sleep study, shows a percentage of both deep sleep, which we call slow wave sleep or delta sleep, and REM sleep. In deep or delta sleep, that's when the brain gets cleaned out. REM sleep is when we consolidate memory and kind of restore and refresh the brain and learn, basically solidify our learning for the day. So the deep level and REM are critical, and when your sleep is interrupted, you have to start on the superficial levels and you have less and less. So some people have no REM sleep and some people have no deep sleep. So it depends on the individual, but overall, when you use a CPAP, if you're using it successfully, you're going to have a restoration of deep and REM sleep, and the same should happen with oral appliance therapy. And does.
Okay, I just didn't know if, if there was a preferential non-preferential loss of a particular type of sleep due to CPAP, non-compliance or non-acceptance or inability. Is it the first half of the night that tends to get compromised or the second half of the night? That's why I was wondering.
No, we have more REM sleep in the second half of the night as our sleep cycles go on. We go up and down in sleep all night long. We have four to 5 cycles of 90 minutes cycles of sleep. But and REM gets larger and larger. That's why REM is when you have dreams, and that's why you remember your dreams in the morning, because that's really when you had most of that cycle. But anything that interrupts sleep is going to limit the amount of both deep sleep and REM sleep.
Okay. Just want to make sure. So back to oral appliances. So the acceptance rate is super high, which is great. For listeners that don't know, how do they work?
Well, they primarily work by pulling the jaw forward. Just like if you took a CPR course, you have to bring the jaw forward and tip the head back to be able to breathe for somebody. So pretty much all the oral appliances on the market act solely by pushing the jaw forward. What I did is I realized there were two other problems that oral appliances weren't addressing. One was nasal blockage or resistance, the harder to breathe through your nose or not being able to breathe through your nose. And the other is the way we've developed habits of using our throat and swallowing, which make the muscles weak. And what I did is I found a way to actually do multiple actions of addressing different areas with one appliance. So it's kind of like your phone doesn't just make phone calls, it does all kinds of other things. And so what I did is I incorporated 3 different actions affecting 3 different areas of the upper airway. And because of that, we get really good results. And there's just a published study showing how the Oasys, which is my system, is effective for severe cases of sleep apnea at very high levels, which is an improvement in overall effectiveness of oral appliances.
So a normal appliance, you'll put it in your mouth like a mouth guard, and it'll pull your lower jaw forward, like you'll set it to a certain advancement of your lower jaw. Is that how it works?
Exactly.
And what when you advance your lower jaw, I mean, how far do you advance it? Do people advance it a lot or a little bit? Is it a millimeter, or what's the measurement?
Well, think of how far you can protrude your jaw. It's usually about 70 or 80% of that. Some appliances overstretch it, like, an athlete who's the trainer's stretching their hamstring out, they can lift their leg so far, but if somebody pushes it for them, they can go further. That's called passive stretch. Some appliances apply passive repositioning to overextended, but our appliance is about 70, 80% of what you can push your jaw forward.
Is there any benefit to simply keeping the jaw as it is when you're awake and just prevent it from going backwards?
A little bit, but if you have apnea, you have to, you can keep the jaw from falling back, which is helpful. But pretty much if you have apnea, you need some sort of repositioning forward.
And how much of the mouth space is taken up by a typical appliance? Where can the tongue go? Is it restricted in its movement? How do you breathe properly?
Well, when you bring the jaw forward, the whole purpose of bringing the jawbone forward is to bring the soft tissue with it. And that's actually one of the problems I addressed, is that sometimes the tongue itself is kind of rolled up in the back of the throat and hasn't been functioning well, and the muscles of the throat are weak. And I developed part of my appliance, a system that keeps the throat from being lazy and helps the tongue go up to the palate where it's supposed to be. So we're helping the tongue position itself correctly and to use and to swallow and use the throat better, which strengthens the muscles there. We're also using it for kids with speech pathology, kids who have lisp and tongue thrust. And we make a little tiny version with the pads that go to the root of the tongue, and they wear it at night when they're sleeping, and it makes them use their throat correctly because they can't be lazy with their throat. And in about 4 months, they're speaking normally. It's really cool, actually.
It's really cool.
Yeah, it is.
So, all right. So a typical oral appliance will advance the lower jaw. So can you recap again, what are the elements that yours includes, the Oasys that are in addition to that?
Yeah. So let's start with nasal dilation. So if you're breathing right now through your nose, which you're supposed to, people ask me, how often should I breathe through my mouth? And my answer is as often as you eat through your nose. So you want to be always breathing through your nose because you produce nitric oxide in your nose, which is an important chemical for the oxygen to get into the red blood cells and then be delivered to the mitochondria where you use it. So you want to be able to breathe through your nose, and you want to be able to breathe with less work to do that. So the first component is nasal dilation, which we do from inside the mouth. If you just blow up your cheeks right now, your upper lip, you'll notice that you can breathe easier through your nose. And that's kind of what the appliance does from inside the mouth. We bring the jaw forward like all appliances, and then we have pads that go to the root of the tongue to activate and position the tongue properly. And so we have 3 different actions in one appliance, and it's actually takes up less space inside the mouth than a lot of other appliances do. So we've designed it to make the inside of the mouth, where the tongue is the least obstructed by having anything in there.
And what do people experience when they first use it? Is it weird? Is it hard to get used to? Or like what happens over the first few nights?
Well, I think the analogy and what I use with my patients is I say that this is a foreign object. If all things being great, you wouldn't put anything in your mouth at night. You would just go to sleep. But this is like glasses for your throat. If you need glasses, you put them on, and they're not there to be comfortable or to be, beautiful. They're there so you don't have to strain your eyes to see, and you can relax and walk around and function in your life. When you wear an oral appliance for sleep apnea, your brain loves it because, first of all, breathing easier through your nose relaxes your whole body. Second, you're not having interruptions. So it's a foreign object, but actually most people report that, they actually like wearing it and feel better with it because they know that they're sleeping better, and your brain unconsciously wants it. So we've had a number of people, including myself, that they say if they decide, I want to take a break and not wear it tonight, that they can't fall asleep until they put it in, and the brain kind of says, okay, I'll fall asleep now because I know I'm not going to struggle all night.
What happens if you're congested? You've got rhinitis, or you just don't breathe through your nose for a long time. You're not used to it. Can you still use it?
That's a good question. And the reason it's a good question because I've had full-blown flu for a number of times, and other people reported, and your whole face is swollen and congested, and you feel like, well, I'm not going to be able to use this, but you put the appliance in, and 5 minutes later, the nose drains, and you can breathe through your nose all night. So it actually can benefit you. I've been amazed at times that I was really sick, and I can't believe I'm falling asleep and breathing through my nose all night long with the flu that I had. If you wonder how people who are mouth breathers, it's so irritating. And if you're a nose breather and you're never breathe through your mouth and you're congested, it's like it's just terrible to have to breathe through your mouth, even for one night. So this actually helps that.
But if you are congested, if your nose is blocked or just swollen, can you breathe through your mouth using the oral appliance, or you have to breathe through your nose to use it?
You can breathe through your mouth if you need to, but we want you breathing through your nose for a lot of good reasons.
Right.
Yeah.
Well, I just know, like for myself, for instance, for years, my nose was always stuffed up until I changed my diet. Now it's better, but still. But some people, I'm sure, they have, their nose is always a mess, and they breathe through their mouth, and, the appliance would make them sleep better, I'm sure, but they're just not going to be able to transition to nose breathing maybe right away. I don't know.
Yeah, well, that's what I'm saying. What part of what I'm trying to do is get them to be able to breathe through their nose and change them to nose breathers. And like so 30% of people absolutely need the nose addressed. So if you had sleep apnea and you were using an oral appliance, what it sounds like for you is you would want to use the Oasys because this is the one appliance that's going to help you breathe through your nose better. If you just bring the jaw forward with people who have problems, they're not going to get as good a result, if they're mouth breathers, because your tongue has to be in the wrong position when you're breathing through your mouth. You have your tongue's down and back, and it kind of throws everything off. So you want to have your tongue at the roof of your mouth, touching the skin of your palate, lips together, breathing through your nose. That's what I tell people. The period at the end of the sentence when you stop talking is to form that posture, breathe through your nose.
Is there, when people use the oral appliance, is there training? It sounds maybe silly, but do they need training on how to breathe through their nose and how to position their tongue properly?
Yeah. We give them simple exercises to do that and reminders. And once you can breathe through, the research shows that if you can breathe through your nose, your brain's going to elect to do that. So basically you kind of build the field and they will come. If you open the nose and make it easy to breathe, you'll start breathing through your nose.
So what do people experience first night using it versus subsequent nights? Like how long does it take them to get used to it?
Well, usually not long. It's surprisingly easy to get used to. We tell patients, like the first couple of weeks, they're getting used to wearing your glasses. You got something that's not usually there, but again, if you can fall asleep and sleep deeper, you're going to treasure that. And so, it's surprisingly easy to get used to.
And what do people experience how does their sleep change and how quickly and what do they tell you?
Yeah, sometimes it's right away and sometimes it takes a little bit. What we know about is that when people have sleep apnea, their throat is kind of battered from it and inflamed, and the saying is that studies show that you need to basically 3 months for all that to settle down. So there is a long-term but improvement by not having the condition and breathing through your nose again. But the change can be right away. Usually, we put it into the patient. It's very easy to put in and train them and adjust it, fine tune it, and then we give them 2 weeks and come back, and then we do a fine tune and any pressure on the teeth. So the goal is to find the best position for it, and then to have them breathe through their nose, and to make sure that it's as comfortable on the teeth as you can make it. Also, we just got a contract. We just got a contract with the Air Force where we're going to be doing studies to give them to their personnel and combine this with a system that will find the right position for them to be in and to maximize the effectiveness of this. So I'm very excited about that program, which is going to begin in a few months.
Well, that's great. What about the person's jaws? Do they get jaw pain? Does it activate TMJ? I mean, does their mouth reshape over time?
Yeah, actually, that's another good issue. A lot of times in the initial examination, we want to look at the person's bite. What you want to think of teeth as, both for jaw problems, TMD, and head and neck pain, which jaw's the most sensitive part of the body. The jaw and the hands, as far as real estate, a third of your brain sensory motor area goes to your mouth and throat. We talk, we kiss, we breathe, we swallow. All this stuff takes incredible sensitivity. Chewing, where we're using incredible muscles that have to be coordinated. So the brain has a lot of actions and sensitivity to the mouth and teeth. That's why teeth hurt so much when you have a cavity. That nerve tissue is not there to tell you have a cavity. It's there for normal function. So the way that your teeth support your jaw in space is important to the health of your jaw joint, your facial muscles, and to your airway. And the jaw, a lot of times, the way orthodontics was done was actually harmful to those systems because we extracted teeth, we used headgear, we tend to close things down, or people didn't grow right and they had a deep bite with a retruded jaw. And so if you have those pre-existing conditions and you bring the jaw forward, it actually likes that. It has less pressure in the jaw joint. The muscles are actually supported better. And then you take it out in the morning and you have to squeeze up. It's kind of like you're putting on a shoe that's a couple sizes too small for you, and your jaw has to squeeze together. So that's a reason why instead of using all these over-the-counter things, you should have a dentist who knows what they're doing and could evaluate all these things, because there's big issues to manage to make sure that it's safe and to inform the patient about their particular condition and what they might expect. So that's part of the science of practicing dental sleep medicine.
Oh, so are there over-the-counter like Boil and Bite, cheapo oral appliances out there?
Yes, there are.
And then are they actually dangerous, or are they just not very efficacious?
Well, they're not very efficacious. They have to be bulky, and they have to be, one size fits all. There's some of them you heat up and you press your teeth in and mold it to your teeth while it's hot. But again, it's bulkier and it's not as easy to individually adjust it. It's also, you're not getting managed any of your potential problems. Some people use it to see, okay, if I advance my jaw, would that be helpful to me? And that's not a bad way, to do it. It's kind of will this have a potential for helping me?
So in order to get an oral appliance, you'll go to your primary care first, and then to a specialized dentist like you, or a sleep scientist, sleep doctor? I mean, what's the protocol? And you do a sleep study?
Yeah, you want to get you want to get a sleep study and get a diagnosis, which has to be done through a doctor. So your diagnosis is through your physician, who's hopefully a sleep specialist, or any physician can order the sleep study. Sleep specialists read it and evaluate the study, and then you get a prescription. Now, most of the time, the physicians are going to want you to have CPAP. And even though their own practice parameters say that first-line treatment for mild to moderate, if you fall in that category, is either oral appliance or CPAP, there's a training there's a training bias for physicians to do CPAP and try to get you to be successful with CPAP. The standard of care is that if you have severe, you should try CPAP first. And if you fail CPAP for any reason, then oral appliances are indicated for severe. So if you have mild to moderate, you should be able to go to your doctor and say, listen, I know that I'd prefer to have a mouthpiece rather than the cumbersome, CPAP, which if I travel, if I, sleeping with a partner, young people, if they're dating, they're not going to, it's going to be, something that they're not going to want to use. So, the diagnosis is medical, and then a trained dentist should be doing the appliance for you. And not all dentists are trained in this, so it's something that is new, and that the schools are starting to teach that. But you want to make sure your dentist, you want to go to somebody really who got a lot of experience in this.
Yeah, how do you know? I mean, I guess when you should ask your dentist, hey, do you deal with sleep disorders, or you're looking for a new dentist? When you call around, you should ask that question. Is that the best way?
You should ask your dentist, if they're a general dentist, you're seeing them for regular care, and pretty much all day long they're doing, they're good dental work. And every once in a while they make an appliance for somebody. You probably want somebody who's kind of dedicated their practice and to do a lot of sleep apnea and have a good experience. Like anything else, you go to your family practitioner, and then they refer you to an ear, nose, and throat doctor for your nose. They don't, they'll do some of it themselves, but if you need something, they refer to a specialist. And this is something which the same, thing is that you should have somebody who's well trained and versed in this therapy.
If when you see patients, or when a dentist sees patients, can they tell based on what's going on in the mouth or the distribution of plaque or things like that the person might have sleep issues? Or does the person have to say something?
We're trying to get dentists to screen for things like high blood pressure and health, general health things, because people see their dentist more regularly for cleanings and things like that than they do their family physician. So hopefully dentists are asking, hygienists are talking to their patients, how's your sleep? You're tired during the day. Is your husband keeping you up? Your wife, whatever, snoring can be a problem for the bed partner. And they should do enough screening that they could say, hey, I think you should tell your doctor that you might have sleep apnea and get a sleep study, or refer them to a sleep study. So dentists should help screen the patients who need this, but patients that start recognize if they're tired during the day, if their partner's snoring or they're snoring, various things that indicate that they have sleep apnea. The thing about apneas is that it's just like a dream. You wake up and you had a dream, and most of the time you can remember a dream for a few seconds, and then it kind of fades away because it doesn't get stored in long-term memory. Your disruptions over the night are not stored in long-term memory, so you're basically jolted awake by choking all night long, but you don't remember any of that. You just feel tired during the day when you wake up instead of rested. So you start to pay attention to how you feel, when you wake up, and if you fall off during the day or you have trouble staying awake at meetings, that you should do something about it, because that's affecting your overall health, and it can be cause of death.
Accidents, things like that. Being ornery and just annoyed at everyone around you, can't focus, can't concentrate. I understand.
Yeah, affecting
from
sex life to if you don't have enough sleep, it's the equivalent of being drunk.
Yeah, not in a good way either.
Yeah. Exactly.
None of the happy buzzing benefits, I know they're limited. Do you see a lot of people are surprised when they're when they do a sleep study and they're told that they have apnea?
Not really. Most people kind of had they hear enough about it now and they had a hunch. It's almost that there's a little bit of self-selecting, that the people who go in for sleep studies are the ones that, hey, I probably do need this test. And so majority of sleep studies come out positive, but that's because of that selection that's happened before you do the test. It's not like a routine test that you're going to get your blood done anyway, every year. It's something that you only go in for a reason.
And what about home sleep study versus in a lab? Are both okay?
They're both okay, and insurance companies are now kind of taking over medical care and requiring home sleep tests because they cost about 1/10 to 1/20th of a overnight sleep study in a sleep center. So a lot of insurances now are using home tests. Patients like it; it's convenient for them. They put on going into a strange place and having somebody watch you all night and being hooked up from head to toe interrupts sleep. We hear it all the time. I don't know how they could have got any data from that test. I don't think I slept all night, but you did sleep some of the night, and they're using that data during your sleep. So they're both, a full sleep test is looking not just at obstructive sleep apnea. There's a whole 7 or 8 different sleep conditions, from narcolepsy, cataplexy, restless leg syndrome. There's other medical conditions that are better looked at or need full nights in-house sleep studies. Obstructive sleep apnea is a blockage of your throat and airway, and that does home sleep tests do a good job of recognizing them.
So what do you see as the future of sleep science? Where's it going? Is it just more awareness of it? There are new gadgets coming?
Well, we're always looking for ways to improve things. In this field, there's a company that's doing surgical implants that recognize when you have the apnea, and it's almost like a heart pacemaker. You see a lot of advertising for that. It's expensive. It's very invasive. I can't understand how the medical profession in general would go to that. To me, it's not ethical to go to something like that unless the patient requests it, without trying something that's more cost-effective, less invasive, and reversible. So it's expensive. So there's technologies like that. There's surgeries that can be done to basically facial reconstruction surgeries. They're, again, very, there's a risk to do that. It's, basically cutting your upper jaw free and your lower jaw free, moving it and putting plates in to keep it in place. We're always looking for better ways to treat things, and we're not going to stop with sleep apnea. There's also looking at medications. What medications might be helpful, and I don't know of any that they found, but I know that they're looking at things like that, and they've identified some possible routes to do that with. But right now, the state of the art is mechanical opening of the airway through jaw repositioning or air splinting with CPAP.
Okay, well, very good. Unfortunately, not everyone can see you, but where can they find out more about the Oasys, and where can they find out more about your particular practice, and what's local to you? Where can they go?
Yeah, so I'm Mark Abramson, DDS, and I'm in Redwood City, California, so that can look that up. The appliance is called the Oasys, OASYS, and our laboratory is called Dream Systems Dental Laboratory in Roseville, California, so all those can be Googled. We can find dentists in other areas. If you call the lab or the office, we can find out people who use our appliance in different areas. And you should get your sleep addressed so you can have good, healthy, deep sleep and live a long, healthy, happy life.
Very good. Yeah. Well, Mark, thanks so much for coming on the podcast again. I appreciate it.
You're welcome. Nice to talk to you.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.